Today I'm going to talk about a very important topic, breast cancer. It affects 1 in 8 women. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Deito, a family physician. I have interest in cancer prevention and also public health. Breast cancer affects over 2 million women worldwide, according to WHO statistics, and causes about 600 deaths of women worldwide. So early detection of breast cancer is the best way to help in treatment, and it also helps to improve prognosis. The breast has different parts. We have the lobules, which are the milk-forming part of the breast, and we have the ducts, which are the milk-carrying system of the breast, and then we have the surrounding mesenchyma, which supports these tissues. So breast cancer can affect the lobules, or it can affect the ducts. So what are the signs and symptoms of breast cancer? The first sign we have is nipple discharge. This could also be manifested with a change in the skin color and also dimpling of the skin. You can also have a change in the breast size, and also you can also have change in breast shape. You could have also changes in the nipple, where you can have the nipple becomes inverted inside, or it becomes retracted, and also you can also have masses or lumps in the breast. Let's look at some of the risk factors for breast cancer. One of them is older age. As you get older, the risk increases. Usually happens more in women above 40 years. We have breast cancer in the family. If you have a sister, a mother, or an aunt with breast cancer, then you have a higher likelihood of getting breast cancer. Then also, those who have dense breast, we have genetic predisposition. There are various factors genetically transmitted, which make some classes of or some groups of women more predisposed to get breast cancer. Then also history of hormone exposure. We have failure to breastfeed, and also we have early onset of menarche, and also late onset of menopause. This predisposes the women to more exposure to hormones. Hormone replacement therapy, especially for postmenopausal symptoms. Then you also have lifestyle influences. Those who are obese, living a sedentary lifestyle, smoking, and also high alcohol intake. These are some of the risk factors for breast cancer. So, what are the screening methods that are available for breast cancer? Mammography is the recommended screening test, and it is to be done from the start of the age of 40, but also for women who have other risk factors. This screening can be started earlier, especially if you have genetic predisposition and those who have family members who have a history of breast cancer. So there is also the clinical breast examination, which is done during routine health care, where the health provider does a breast examination. And we also have the self-breast examination. This can be done by the patient herself, and it helps detect lumps in the breast, any abnormal changes in the breast, and should be done on a monthly basis, especially after the periods when the breasts are less sensitive due to hormonal effects. Other screening tests include ultrasound, especially if you have abnormal mammogram. We have MRIs. This can be done for those who have higher risk of getting breast cancer, and also if the mammogram is abnormal and there is no exact location of a lump, then an MRI can be recommended. Then also biopsies of any breast masses will help make a diagnosis of breast cancer. So breast cancer can be classified into invasive and non-invasive. Invasive is breast cancer that spreads out beyond the normal breast, and this can be ductal breast cancer, and you can also have lobular breast cancer affecting the lobules. As I said earlier, that the breast has various parts. So we have the lobules and the duct, and this can be affected by the breast. Then there are tests that can be done to test the positivity of various hormones in the breast cancer. So you have triple negative breast cancer, which is negative for estrogen receptors, and you also are negative for progesterone, and also negative for human epidermal growth factor. And this triple negative breast cancer is more invasive, and also it's more resistant to treatment than the hormone sensitive breast cancer. So then we also have the triple positive breast cancer, which also responds very well to hormone therapy. Staging depends on the location of the cancer at the time of diagnosis, and depends. You can have metastasis of the cancer, which can move out of the normal breast tissue to the axillary lymph nodes, can affect the other breast on the other side, and also it can metastasize to the lungs, to the lips, to the vertebral column. It can also go to the brain, to the spinal cord, and also to the liver. So those are the common signs of metastasis of breast cancer. So what are the treatment modalities available for breast cancer? Surgery is the mainstay of breast cancer treatment, especially if the cancer is detected early. There are various types of surgery that can be done. We have lumpectomy, which is excision of the lump and the surrounding normal breast tissue, so that to make sure that there is excision of the cancer. You also have mastectomy, which is total removal of the breast, and the mastectomy can also be radical mastectomy, where there is removal of the breast and there is excision of the muscles and the lymph nodes around the breast tissue. Then we have chemotherapy, and chemotherapy can be neoadjuvant or adjuvant. Neoadjuvant is where you have use of drugs to try to shrink the size and extent of the cancer before surgery can be done. And the adjuvant chemotherapy is the treatment of the cancer after the excision of the breast, and this is mainly directed to remove any remnant cancer that will be remaining, so that there is complete eradication of the cancer. Then we have radiotherapy, which is using radioactive material to try to kill any cancerous cells while preserving the normal tissues. We have hormone therapy, where there are some drugs that are used to try to reduce the possibility of recurrence, especially for the hormone sensitive cancer. And then we have combination of all these methods of treatment. Of course, these days there's also the targeted therapy, where we have various immunotherapy mechanisms which are being developed to help fight many of the cancers that are still the research is ongoing, and it seems to be very promising. So breast cancer is a common cancer, affects 1 in every 8 women, and the good news is that with good screening, which includes self-breast examination, clinical breast examination, and doing regular mammography, can be detected early and can be prevented. So let's all take the steps to prevent ourselves from getting breast cancer. If you like this talk, please share it with others so that we all join hands to prevent breast cancer. Thank you for watching.